let's talk about the emotional side of things. Okay. Um, there were there are fewer slides for this, but that's not any indication that this is less important than the food stuff. Handling the emotional and the mental side of diabetes is equally important to the physical side of food and resources that you're supplying your body. So being diseased and being told you have diabetes is not a fault of you, the person, right? When I was first diagnosed, it was like, oh my God, something's wrong with me. There's something wrong with my genes, whatever it is you were told in your endocrinologist's office, your child or you believes that there may be something wrong with them, right? So we need to reconstruct that outlook on a disease state as something in which it's a conversation between you and your body. A disease is your body saying something is not right and I need your help. And then you, as someone with the disease, your job is to help. That's it. Pretty simple. Okay. So it's important. There is nothing wrong with you. You do not have diabetes like as something that's your fault. There's no one to blame. Having diabetes is not the end of your life. Okay. So make sure that you, if you're a caretaker or if you have it and you have someone in your environment who is trying to paint diabetes as this terrible, long, arduous battle that you're just going to have to slog through each day with to get to the end of, cut them out of your life. That is not helpful. It's not true. I am someone who has lived with this for over 22 years. I live a very fulfilled life. It doesn't have to be that way. Counter that point, talking about the anti-fragile aspect of getting you or your kids out and doing different things. Don't wrap your kids in bubble wrap, right? Like, we are resilient. We are a resilient being. Master the basics of having that emergency sugar, of knowing how to speak up if you need something, and then go be a kid, go live, have them educated, have yourself educated in making good decisions when it comes to food, when it comes to social situations, but don't be the helicopter parent. Don't, deprive yourself of all of life's joy just in the name of health, because how unhealthy is it to do that, So then having a disease does not make you and what you need to take care of yourself a burden to anyone. And this is something I dealt with a lot, something I felt like I needed to take care of. I wanted to make sure that I did a good job with it so that no one else had to do it for me, because if someone else had to do it for me, that meant that I was inconveniencing them. That is not true. Do not make anyone with diabetes feel like what they need to do is an issue or an inconvenience to you. It's not. They have to take care of themselves. Take care of yourself. Let your child ask for help. It is not a burden, right? And don't try and hide that you're diabetic at all. I have most of my life, because my idea of being a good diabetic was that no one would know that I was diabetic, right? Like, oh, I'm so good at this, I seem normal, but I'm really not, right? Bad news, right? Because in the event of an emergency, nobody knows what's wrong. Nobody knows how to go about helping you. So do not be shy in sharing your story. Do not be shy in doing what you need to do to take care of yourself. Not a burden, not an issue. You do what you need to do, right? And then from the isolation standpoint, I mentioned before that it can be very isolating, and you kind of feel the weight of the accountability and the responsibility of having to take care of yourself. So having diabetes can breed hyper independence, where you aren't willing to accept help from others. I was kind of the kid that suffered in silence. If I was having an issue, I felt like it was mine and mine alone. Did not feel comfortable sharing it with anybody else, and so it was my burden. It was my weight, and so when things went bad, it was my fault. All the shame, all the guilt, it all weighed down on me, right? So if you are a caretaker for someone with diabetes or you have diabetes yourself, do not shame yourself for learning the ropes of a very, very complex and multifaceted disease. Very few people understand just how deeply rooted diabetes is and the weight that it creates and the relationship, how it changes your relationship with so many things in your life that a lot of people take for granted. And in the stumbling and the fumbling and kind of floundering that may happen when you first get diagnosed, this can make you resent yourself because you can't figure out why you're not getting it or why you keep making similar mistakes over again. And let me tell you, I'm 20 plus years in, still making very, very, first grade mistakes, because your body changes over time. Your relationship to different things, the environment, all of the different variables going into the situation is going to give you different outputs, and it can really, really weigh down on how you feel about yourself. Okay. I'm someone that stuck with it and kind of always, rocky, it wasn't always a straight line up, but I worked my way up. Other people, they have it for 5 or 6 years and they just let their bodies completely disintegrate. And it stems from not feeling worthy. Why bother? It's all going to end anyway. It can turn very, very ugly very quickly. And it's scary. It's scary, especially for those diagnosed early on in life. You are new to life. All of this is brand new. And then all of a sudden you're scared of doing very normal things like eating food, like going to friends' houses, like playing outside. And so the hypervigilance and the hyper awareness can breed this, this sympathetic overload of fight or flight because, oh my God, did I just give myself too much insulin? Oh my God, am I allowed to eat this and this? Or is it only this? And you get lost in the sauce. If your blood sugar goes too high, you're like, how serious is this? Are my feet going to fall off? Oh my God, my blood sugar's low. Press the panic button, everything, it can be so overwhelming, especially in a young body. It's so important that there is a support system in place and that very few things in the state of diabetes are so immediately emergent that if you don't take care of it, everything goes to shit. And so, obviously there is the caveat of an extreme low blood sugar, a loss of consciousness, something like that. That is obviously an exemption to the rule, but and even these things here aren't something that you can avoid. There's going to be some worry, there's going to be some panic and some scare, but in experiencing them and in experiencing them with a supportive team of people who are there to help you and support you, the edge starts to wear off and you start to be more confident in handling yourselves in these situations, and you start to realize that they aren't as weighted as you may think they are.